This is an example of end-stage renal disease. For orientation, you can see the aorta here, moving from proximal to distal, and the two kidneys. End-stage renal disease, also known as kidney failure, is the final stage of diverse chronic diseases of the kidney. At this point, most patients are being treated with dialysis. Two of the most common causes in adults are hypertension and diabetes. Grossly, both kidneys are shrunken and small, and you can see a granular surface as well as multiple cysts when the renal capsule is stripped back. When chronic pyelonephritis is the etiology, deep scars from abscesses can be seen, which we do not see in this case. In all cases, histologic evaluation reveals diffuse glomerular scarring that can appear as complete sclerosis and obliteration of the glomeruli. Interstitial fibrosis, tubular atrophy and dropout, and lymphocytic infiltrates are common. Small and medium arteries have thickened walls with narrow lumina.